Do you have a red and sticky eye? What could it be? Well, it could be conjunctivitis. Watch this video to learn more about conjunctivitis, exactly what it is, what the causes of the condition are, and how it is generally treated. Welcome back to my channel. My name is Dr. Shaz Rehan, and my eye education platform, the Rehan Ophthalmology Academy, is designed to provide free eye education for all. If you have been following my other videos, in keeping with my other videos, I will be posting questions within the video throughout to try and help to facilitate and aid your learning. The questions are very straightforward and all of the answers are contained within the video itself, so please keep watching until the very end. For small and startup channels such as mine, the support of viewers is absolutely fundamental, so please consider subscribing to my channel. So the first thing to talk about is what conjunctivitis actually is. In order to understand this better, we must first completely understand what the conjunctiva actually is. So when we look at somebody's eye, the white part of the eye actually has a transparent layer covering it on the top. This can be thought of almost like a layer of cling film that is on top of the white layer of our eyes. The white layer of our eyes is called the sclera, and on top of this sclera, the transparent membrane is called the conjunctiva. Whenever it comes to anything within the body, itis means inflammation. So conjunctivitis means that there is inflammation of some sort involving the conjunctiva. It is important to also remember here that the conjunctiva not only covers the white part of our eyes, it also forms a protective layer on the inner aspect of our eyelids. Broadly speaking, there are two types of conjunctivitis. The first type is the infective type, and that can typically be caused by bacteria or viruses. And the second type is an allergic type. Symptoms, as you will recall from my other videos, basically means what we experience as patients when we have a condition. In conjunctivitis, the white part of our eyes look red and swollen, and to describe this term, some people use the phrase "the eyes look angry." As well as appreciating this appearance of one's eyes, patients typically experience grittiness, the sensation that something is actually in their eyes, possibly watering of their eyes, and discomfort. If discharge is present due to the conjunctivitis, then some patients report that their eyelids tend to get stuck together, and this is typically more obvious and pronounced when they wake up in the morning. If the discharge starts to affect one's tear film, which, if you remember from my earlier dry eye video, it can blur one's vision, because remember, the tear film is the protective layer that covers the surface of both of our eyes, and typically it is clear in nature. If patients have a viral type of conjunctivitis, then it is possible that they may also be feeling run down with a cold of some sort / a viral infection, and therefore they may also have a sore throat and swollen and tender glands in and around their neck or behind their ears. Some differentiating features between the three types of conjunctivitis that I mentioned earlier, namely bacterial, viral, and allergic, are as follows. Allergic conjunctivitis typically tends to involve both eyes, and with respect to the bacterial and viral conjunctivitis conditions, they typically can affect both eyes, but they may start off affecting one eye initially and then move over to the fellow/second eye. Another typical differentiating feature between bacterial and viral conjunctivitis is the nature and appearance of the discharge. So in bacterial conjunctivitis, typically one will see a thick yellow-green discharge, which is referred to as a mucopurulent discharge, whereas in viral conjunctivitis, the discharge tends to be more water-like. In all three types of conjunctivitis, the eye tends to be red, and it is almost exclusively in the allergic type of conjunctivitis, similar to when we are having an allergic reaction of some sort in any other part of our body. Allergic conjunctivitis tends to give us the sensation of needing to itch. If you are finding this content useful, please do consider subscribing to my channel. Conjunctivitis tends to be a very common condition, and it not only affects adults, but it also affects children. Have you ever had conjunctivitis? If so, do you know which type it was? What treatment did you have for the condition? Please do share your comments below. Conjunctivitis, especially the infective type, is typically referred to as a condition that is called a self-limiting condition. You may have heard this and wondered what it exactly means. Well, in simplistic terms, it literally means that if one does not actively treat the infection with antibiotic drops, for example, the condition will naturally clear up and basically burn out over a given period of time. With conjunctivitis, this burnout period can typically range between a couple of days up to a week or two. Your eye care professional may consider providing you with some antibiotic eye drops if the condition that you have is a bacterial form of conjunctivitis. If one has a viral type of conjunctivitis, then antibiotic eye drops serve no benefit at all. As with all infections, typically our bodies will need to try and fight off the invading virus and build up immunity to it over time. Other eye care professionals also consider prescribing lubricating eye drops, and this can be very helpful in trying to relieve symptoms of eye discomfort. But bear in mind that these lubricating eye drops are not helping to clear up the infection or reduce how long the infection will last. They are simply to aid with ocular discomfort. If your symptoms of ocular discomfort are particularly bad, then simple over-the-counter medications such as paracetamol, for example, may be advised by your eye care professional. However, in the first instance, a simple yet effective measure that may be advised by your eye care professional is the use of cold compress on the eye. If you do indeed have sticky eyelids secondary to sticky eyelashes, then your eye care professional may advise you on good lid hygiene measures in order to try and clean the eyelashes. When it comes to the allergic type of conjunctivitis, there may be a need for you to start anti-allergy eye drops, both in the short term and possibly in the long term. And in addition to this, your eye care professional may advise a short course of tablet antihistamines. None of the above mentioned medications should be started on your own accord, and please do seek professional advice and help prior to doing so. I would love to hear from you if you are watching. Have you ever had conjunctivitis? Did you use any of the above treatments, or did you just sit tight and let the condition run its course? If you did have treatment, what did you find to be of benefit? How practical did you find using cold compresses please do share your stories in the comment section below. When it comes to treatment, some other general considerations to bear in mind are, because the condition may indeed be infective, it is very important that you adhere to strict hygiene practices. This is particularly important in the current state of the world as we are passing through this global pandemic. So hand hygiene has never been more important than it is now. It is advisable that females also throw away their makeup because that may indeed be infected with the bug that has caused their eye infection. The reason these practices are important because, as I mentioned, viruses and bacteria, particularly viruses, can be easily transmitted from one eye to the other and then to other people. Transmission methods include coughing, sneezing, sharing towels, touching surfaces, the list goes on. That's why frequent hand washing and not sharing towels with other family members or friends that you may be living with is very, very important. You may be a contact lenses wearer and wondering whether you should continue wearing your lenses. I would suggest that you do not wear your lenses until the infection has cleared up, and the best person to help to advise you regarding this is your eye care professional. The reason why it is advisable not to wear contact lenses during periods of active infection is because, number one, they may not indeed feel comfortable in your eyes anyway. Number two, in the presence of discharge, it will only blur your vision. Number three, when you are taking out your lenses or putting them in, if you do indeed manage to somehow cause a micro trauma to the front of your eye, which is the cornea, that then essentially creates a passageway for the bugs which are currently on the white part of your eye to get into your cornea and potentially cause an infection. This is very undesired because a corneal infection, particularly in the presence of a contact lens, can be a lot more serious. That brings us to the end of this video. Thank you so much for watching as ever. I hope you enjoyed the content that I presented today. Just as a refresher, what we discussed was what conjunctivitis is, what types there are, how it affects individuals, and what treatments and considerations that we should factor in if we do indeed have the condition. I would be tremendously appreciative if you could kindly subscribe to my channel and help to support it. Also, please do comment down below and tell me about your experiences with conjunctivitis or any questions that you may have, and I will do my best to try and answer them. As ever, if you do want to stay right up to date with my video releases, then consider clicking on the bell icon.